Imagine you're teaching Pilates for 20 years, mastering every move for a strong, healthy spine. You're fit, you're functional, and you look great until low back pain and sciatica silently creeps into your life. So you use your expertise to manage that pain, and it works. For a while, it works for years, until suddenly those go-to exercises fail. In other words, they stop working, the pain doesn't go away. So you seek out help, you see a chiropractor, he does some weight-bearing postural x-rays, and the results of those x-rays are shocking. You have advanced degenerative disc disease and osteoarthritis in the spine. I mean, how could that happen to this expert? As a practicing chiropractor for over 38 years, this patient history is a common sight. I have patients come in and they say, "Doc, I used to play basketball for years, and then I started getting this low back pain. I had to stop and just start running. But then after several years, the pain came back, so I had to stop running. Now I'm doing the elliptical." Or another patient playing tennis for years, they start getting severe pain, so they have to stop the tennis, and now they're playing pickleball. And as a chiropractor, this is frustrating to see this pain and limitation cycle just happening silently, gradually becoming more and more disabled, only to be told by their orthopedic surgeon that it has to do with aging. And I'm here to tell you that's not the case, because I found that it has to do with structure will precedes function. Is that with myself and other patients that are able to help people by changing the structure? Because a normal structure, lumbar spine, when you look at it from the front on x-ray, should be straight. From the side, it should be a nice curve, 35 to 40 degrees. That's springy. When it's that way, the spine and the body moves better. The muscles don't have to pull as hard. It's going to be in alignment. People that have chronic low back pain are typically going to have a decreased lumbar curve or a hyperlordotic curve, which means the joints, the spinal joints and discs are chronically out of alignment. It's going to create abnormal stress and loads, makes the muscles work much harder on that weakened spine. And because of the misalignments and abnormal loads, it'll gradually start wearing that area to where you have this silent process of degenerative disc disease and osteoarthritis setting in. And if it goes years and years without being checked and corrected, that things get worse, and it can become things like lumbar spinal stenosis. The key is structure precedes function, is correcting that structure, which I go over a 5-step protocol in my video, How I Beat Lumbar Spinal Stenosis. So to give you an example of how structural rehab works to restore the lumbar lordotic curve is I would have exercises and traction. So the exercise would be an extension type of exercises. For example, a modified Cobra push-up. And we'd use long hold isometrics of greater than 30 seconds, 5 to 10 repetitions, and then we move on to the traction. It'd be extension lumbar traction. So you can use either the towel, or you can get more specific forces by using the orthotic dinner roll block, and you'd gradually work up. So you'd start off 30 seconds to a minute on that block, gradually work up until you get to about 20 minutes. And from that time under tension creates viscoelastic changes in the soft tissue, the fascia, the ligaments, the disc in that area, to where it will start molding in a more optimal lordotic curve. And over time, it pushes it more and more closer to that optimal correction for you, which means if you can restore the normal lordotic curve, now the joints will be in better alignment. You're going to slow or stop the degenerative disc disease or osteoarthritis, and you're going to decrease or eliminate that pain. It's going to allow that better structure, will allow for better function when you apply those functional exercises. However, to get the most out of this type of care, I'd recommend that you see a corrective care chiropractor, to at least where they can monitor your homework. You can get an initial x-ray. They can see what type of traction would work best for you. And you can perform these exercises and traction at home. And then in about 3 months, they can do a post x-ray and they can monitor your care. They can monitor your progress. So the key to not getting blindsided with these conditions like the Pilates instructor is to correct the structure so all these great functional exercises will take off. I'd recommend that you check out this next video where it goes over the 5 protocols that I use and how I beat lumbar spinal stenosis. Press the subscribe button. Share this information to people that really need it. We appreciate serving you. Keep spreading the word, and we'll see you in our next video.